Welcome to the Texas Health Fort Worth Kidney Transplant Orientation. Our objectives are for you to know what each team member can do for you, learn about the transplant evaluation process and the risks and benefits of kidney transplant, understand your responsibility before, during, and after kidney transplant, and to find out what resources are available for transplant patients. We encourage you to take some notes as you'll be able to ask questions at the end of this presentation. This is the contact information for our kidney transplant team members. Our team includes transplant nurse coordinators, department assistant, scheduler, social worker, dietitian, financial coordinator, pharmacist, and living donor patient advocate. The living donor patient advocate solely represents and assists a potential living donor who wishes to donate a kidney to one of our listed candidates. Patient information is kept strictly confidential for both the living donor and their intended recipient. Living donors must complete an evaluation similar to the recipient evaluation. Living donation is highly encouraged and is statistically the best option for any transplant candidate. Patients with chronic and end-stage kidney disease have treatment options. It is important to understand that kidney transplant is one of those treatments and not a permanent cure for kidney failure. Other treatments include hemodialysis, completed 3 times per week at a dialysis center, home hemodialysis, patient self-administers hemodialysis treatment at home 3 to 5 times per week, and peritoneal dialysis, which is dialysis through the abdomen each day of the week at home. Your nephrologist will help you decide the best treatment for you. Kidney transplant is not always the best option. You have the right to refuse kidney transplant evaluation at any time. To begin the evaluation, recipients must complete the transplant orientation and sign a consent to initiate testing. You may complete the 6-minute walk, labs, and testing at the on-site orientation. Transplant evaluation is generally completed in 1 day. The evaluation appointment usually lasts 6 to 8 hours and will include the following: blood work, which is approximately 22 tubes, 6-minute walk test, so please wear comfortable shoes, EKG, echocardiogram, and chest x-ray. Candidates and their support persons will meet individually with the transplant nurse coordinator, social worker, financial coordinator, and dietitian. Please bring your support persons to this visit. Additionally, you will have a second lab draw for blood type verification, physician assessments by the transplant surgeon and kidney doctor, and a medication review with the transplant pharmacist. If you have completed some of the testing recently at other facilities, we may be able to obtain those records. The surgeon and doctors may ask for other testing that may include CT scans, carotid ultrasound, nuclear stress test, heart catheterization, and a psychological consultation. All candidates are required to complete age-specific cancer screenings. The health maintenance screening requirements are based on the American Cancer Society recommendations. Again, we may obtain records for any testing completed at another facility. Women will need to have a recent pap smear unless you've had a total hysterectomy with no cervix present. And you'll need a mammogram if you're over the age of 40. Men over the age of 60 may need a prostate evaluation by a urologist. All patients over the age of 45 are required to have a screening colonoscopy. A repeat colonoscopy would be determined after reviewing your records. Your transplant evaluation must be completed in a timely manner, preferably within 2 to 3 months. Completed evaluations will be presented to the Transplant Acceptance Committee, also known as TAC or TAC. TAC is a multidisciplinary team that includes the physicians, pharmacists, nurse coordinators, financial coordinator, social worker, and dietitian. The Transplant Acceptance Committee, or TAC, determines candidate eligibility for transplant listing based on all information obtained during the evaluation process. The benefit of transplant must outweigh the risk involved as determined by your financial, social, and medical circumstances. You will be notified of the committee decision by certified letter. The committee may reach one of 3 decisions after the patient's case has been presented. Approved. This means The patient will be placed on the wait list for kidney transplant as either active or as inactive. Declined. The committee has determined transplant is not considered a safe option for that patient. The reason for a declined decision is included in the certified letter. TAC hold. This decision means the committee has requested additional action items to be completed before a final decision on listing eligibility can be reached. All candidates approved for listing will be either Status 1 or Status 7. Status 1 is active listing, which means they are ready for potential organ offers and transplant. A candidate listed as Status 7 or inactive is temporarily on hold until additional testing or other concerns have been resolved. This could include insurance changes or recent illnesses. A candidate may choose to be delisted, which is removed completely from the waiting list. The transplant team also can determine transplant is no longer an option for certain patients if financial, social, or medical circumstances have changed. Any change in your listing status will be communicated to you by a certified letter. Approved candidates may choose to be registered at different transplant hospitals. You must complete a similar evaluation with each program. Accrued waiting time may be transferred to the facility of your choice. You may also transfer care to a different transplant hospital without losing any accrued waiting time points. A transplant offer can happen anytime, day or night, so make sure we can reach you by phone 24 hours a day. During your time on the transplant waitlist, you must keep your transplant coordinator informed of changes in your health condition, insurance, social support, or contact information. Changes in your condition may prevent you from safely proceeding with surgery at the time of an organ offer. Changes in your insurance coverage may incur additional costs to you at the time of surgery. Many insurance providers also require prior authorization for your transplant. The average time a candidate will wait to receive a deceased donor kidney transplant is 3 to 5 years nationally. Until you receive a transplant, you will come into the clinic each year to update your evaluation. This is a requirement to maintain active status on the wait list. Active listing status does not guarantee you will receive a kidney transplant. While you are active on the wait list, you will have scheduled blood draws for antibody testing. This is called Panel Reactive Antibody, or PRA test. PRA testing determines what donor antigens are unacceptable by your immune system, which can change over time. If you are on dialysis, your dialysis center will collect the specimen for our HLA lab. If you are not on dialysis, you will schedule a short clinic visit with us to collect the blood specimen after you receive the PRA kit in the mail at your home. Staying healthy and active is the best way to ensure you are ready for a transplant. The kidney allocation system is how donated kidneys are matched with compatible recipients. A new kidney allocation system began in December 2014 to ensure the best use of all donated kidneys. Because of the significant shortage of available kidneys, statistical tools such as the Kidney Donor Profile Index and the Estimated Post-Survival Score were developed. The KDPI estimates how long a donated kidney is expected to remain functional in a recipient based on donor characteristics. The EPTS estimates the years of survival after transplant for a recipient based on the recipient's age, time spent on dialysis, diabetes diagnosis, and previous transplant status. All transplant centers place approved candidates on the national wait list. Before a kidney can be allocated, all candidates on the wait list that are incompatible with the donor due to blood type, height, weight, and other medical factors are screened from the organ match list. The computer application determines the sequence that the compatible candidates will receive offers according to national policies. Blood type and other medical factors weigh into the allocation of every donated organ. Additional factors are unique to kidneys. Amount of waiting time, which begins at the start of your first dialysis, or the date of your listing if you are not on dialysis. donor and recipient immune system incompatibility, or CPRA, the pediatric status, so patients ages 0 to 18, prior living donor status, proximity to the donor hospital or transportation time, and the EPTS score. Each organ offer matched with our hospital's listed candidates is reviewed by the transplant surgeon to assess the quality of the kidney. Not all organ offers are viable for transplantation. When one of our listed recipients becomes primary for an offer, which is at the top of a donor list, and the kidney is of good quality, the surgeon will instruct the coordinator to call our first patient on the match run, which is the list. If the kidney organ offer is determined to be of poor quality, our surgeon will decline for our candidates, and the next patient on the national list will become primary for that organ. Every organ offer is different. Candidates that are highly sensitive to donor antigens now receive priority points on the wait list. The higher your calculated panel reactive antibodies, the more difficult it is to match a donor. Candidates with a CPRA of more than 98, 99, or 100% will receive national priority, as these patients are very difficult to match with local donors. This is why it's important to complete your scheduled PRA lab draws so that the waitlist information remains accurate. The Kidney Donor Profile Index, or KDPI, is a tool used in the allocation system for kidneys. The KDPI score is calculated based on information about the deceased donor. Donor information includes their age, height, weight, BMI, ethnicity, medical history, cause of death, serum creatinine, hepatitis C infection, and donation after circulatory death status, or DCD. The KDPI score ranges from 0 to 100%. Lower KDPI numbers are expected to have longer post-transplant function times. Higher KDPI numbers are estimated to have shorter post-transplant function times. The time of function is not guaranteed for any organ, no matter the estimated KDPI score. A KDPI of 85% or less is considered a standard donor kidney with function time averaging 10 years or more. A KDPI score greater than 85% is considered an expanded criteria donor kidney with function time averaging 5.5 years. Patients will return to dialysis when the transplanted kidney is no longer functioning and may qualify for retransplant. Every donor kidney carries risk of transmissible disease, even though testing is negative at the time of donation. Certain donors may have an identified risk of transmissible disease if they meet criteria defined by the Public Health Service. This includes donors with a history of IV drug abuse or sex with an IV drug abuser, sex with an individual known to have a transmissible disease, male sex with male, prostitution, jail time more than 72 hours within the last 30 days, and donors with no available medical or social history at all. You would be notified of an identified risk donor at the time of an organ offer. The other tool used in kidney allocation is the Estimated Post-Transplant Survival Score, or EPTS. This score is used to match about 20% of donated kidneys. Every adult patient on the wait list receives an EPTS score. This score ranges from 0 to 100%. The factors that affect the score include the candidate age, length of time on dialysis, prior transplant of any solid organ, and diabetes status. Candidates with a lower EPTS score are expected to have more years of transplant function as compared to candidates with higher EPTS scores. The EPTS score is designed to achieve better longevity in matching donors and recipients. Younger candidates with longer life expectancy qualify for kidneys with longer estimated function time, or lower KDPI kidneys. The Scientific Registry of Transplant Recipients, SRTR, is a national database of organ transplant statistics and a way to compare transplant center success rates with national data. Transplant outcome data is collected, analyzed, and published for every transplant center in the U.S. Statistics are updated every 6 months. You may compare outcomes for any transplant center with national statistics on their website at www.srtr.org. If you need help accessing or interpreting the data, your nurse coordinator can assist you. When your big day arrives, you will receive a call from the on-call transplant coordinator. Please note, this call may not come from a local number, so be sure to answer all phone calls while you are active on the wait list. You will be asked a series of questions to ensure it is safe to proceed with transplant. After admission to the hospital, a final cross-check is done between your blood and the donor blood. This is called a cross-match and takes a minimum of 5 hours to get final results. Preparation for transplant surgery will include an assessment by the surgeon and nephrologist. We will obtain basic blood work to check for infection, complete an EKG and chest x-ray. You will sign informed consents for surgery, anesthesia, and blood transfusion. You will also shower with an antimicrobial wash and may need a dialysis treatment prior to surgery. This is all completed while waiting for the final cross-match results. If the cross-match is negative, then you are ready for transplant. Transplant surgery is usually 3 to 4 hours long. You will begin recovery in the intensive care unit for a minimum of 24 hours. Then you will transfer to the transplant unit until discharge. During your stay, education will be provided by our team members to you and your support persons. You will pay for your required anti-rejection medications and have them with you prior to leaving the hospital. You will be taking around 6 to 10 different transplant meds. Your total hospital stay will average 4 to 10 days. After discharge from the hospital, you will immediately have regular follow-up visits in our transplant clinic. Appointments are 2 times per week for the first month, every Monday and Thursday. These appointments are a minimum of 4 hours each. The number of visits will gradually decrease over time as long as you are recovering well. The transplant team will let you know when you can start coming to clinic once a year. Blood work is required for each regular office visit. The nurse transplant coordinator will oversee a patient's journey throughout the referral, evaluation, transplant, and post-transplant phases. It is important to stay in close contact with your coordinator. Keep your phone number and address current. Notify your coordinator of any changes. Call your coordinator with any questions. And notify your coordinator if you have been sick or in the hospital. An organ offer can happen at any time, day or night. Timing is very sensitive once you receive an organ offer. A kidney must be transplanted as soon as possible after it is recovered from a donor. Some of the roles and responsibilities of the nurse transplant coordinator include pre- and post-transplant care, medical and psychosocial evaluations, patient education, patient advocate, inpatient and outpatient clinic, the donation process, 24-hour emergency access for post patients, organ offer review, and waitlist management. The transplant social worker will help the patient and their family manage a variety of issues associated with transplant. The social worker will complete an assessment that includes a psychosocial history, analyzing strengths, support system, and other resources, identifying problem areas, providing community resources or referrals, and determining primary caregivers and transportation providers after transplant. The psychosocial evaluation will help determine if a transplant candidate has the appropriate stability, motivation, and support system to meet the challenges of transplantation. The use of tobacco, alcohol, and/or illicit drugs is carefully examined. Patients with alcohol and drug dependence may require therapeutic intervention and should demonstrate abstinence before listing. Random drug screens may be completed. It is required that you have a primary support person and a backup support person to fill in should the primary person be unavailable. The primary support person must be able to come to the evaluation appointment and meet with our social worker. They will also need to agree to the terms of the support contract. Your support persons can be family or friends. A strong support system is critical to the success of a kidney transplant. The qualified support person will need to drive you to clinic appointments immediately following discharge from the hospital, learn the signs and symptoms of infection and rejection, help manage your pill box, document your vital signs, drain output, and blood sugars. You will not be permitted to drive for approximately 6 weeks following surgery, so your support person would be responsible for this. The amount of information you will receive and number of tasks to complete post-transplant is overwhelming. A qualified support system is vital to good transplant outcomes. A support group is recommended for all transplant patients, their family members, and friends. The education and fellowship is meaningful during all phases of the transplant process. This includes the evaluation phase, waiting for transplant, time of transplant, and afterwards. Contact your social worker for current available resources. The Transplant Financial Coordinator helps to determine a patient's financial eligibility for transplant and will go over your individualized plan with expected out-of-pocket costs. Our patients will need to provide a copy of all insurance and pharmacy cards to our office, obtain a secondary insurance plan to cover the cost of copays, deductibles, and co-insurance, enroll in Medicare Parts A, B, and D. Part D is optional if you have a group health plan through your employer, and develop a financial plan after meeting with our financial coordinator. Before transplant, evaluation testing is billed to our transplant program if you have Medicare as primary coverage. If you have third-party or private insurance coverage, the evaluation costs are billed to your insurance provider. Should you require treatment as a result of this testing, treatment charges would be billed to your insurance, and you would be responsible for the balance. Each patient will be financially responsible for routine health maintenance screenings such as pap smears, mammograms for women, colonoscopy for those over 45, and vaccinations. Non-medical costs may include travel expenses, lodging, meals, lost wages, parking, and childcare. A kidney transplant could cost more than $200,000 depending upon the length of stay in the hospital. Your deductible, co-insurance, and maximum out-of-pocket expenses will vary by insurance coverage. You must pay for your discharge medications prior to leaving the hospital. After transplant, the required medicine may cost between $25 to $500 or more per month. All follow-up care is billed to your insurance company. You should be prepared to return to work before losing your Social Security disability insurance and/or Medicare, unless you are over the age of 65 or you have another type of disability. Your financial coordinator will inform you of the financial cost and insurance benefits associated with your transplant. The transplant dietitian will help patients understand their individualized eating plan and to make healthy goals. After kidney transplant, most patients are able to eat foods high in potassium again, like melons, tomatoes, oranges, bananas, and baked potatoes. Foods high in phosphorus, like red beans, milk, ice cream, and peanut butter, are encouraged. You will also need to keep your new kidney well hydrated with extra fluids, usually 2 to 4 liters of water per day. You will need to watch your weight by monitoring calorie intake and non-strenuous physical activity. The anti-rejection medicines given after transplant can cause increased appetite, weight gain, and make diabetes more difficult to control. About 15% of patients will develop diabetes after transplant, even though they've never had it before. Diabetes education is given at the time of transplant surgery. All recipients must learn to check blood sugars 4 times per day after discharge from the hospital. If you already have diabetes, be prepared to take insulin every day and test your blood sugar up to 4 times per day. You will receive a blood sugar monitor if you already do not have one. Your support person should be able to learn about giving insulin and blood sugar testing after transplant. The transplant pharmacist will provide education to patients about their transplant medicines. After kidney transplant, you will take anti-rejection, also known as immunosuppression, medicine for the life of your transplant. You must take your medicine as recommended by the transplant team. Always contact your coordinator before taking any new medication not prescribed by the transplant team, including those that are over-the-counter or OTC medicines. Many medications have interactions with the transplant medicine. Also, please don't take any herbal products. Always plan ahead. Request prescription refills at least 2 weeks before running out of the medicine. If you travel after transplant, make sure you have more than needed for your trip in the event you get stranded. Never skip your medicines, even if you are sick. If the medications are making you sick, call and speak with your transplant coordinator about your symptoms. All medications have side effects. The required anti-rejection medicine have the following common ones: higher risk of infections, weight gain, post-transplant diabetes, tremors, insomnia, high blood pressure, and loose stools. Most transplant patients will take 3 different medicines designed to prevent rejection of the transplant kidney, along with many other protective medicines. Some of the most prescribed anti-rejection medications include Prograf, Myfortic, prednisone, sirolimus. The over-the-counter medicines listed here are not permitted after transplant, NSAIDs such as Aleve, Advil, Motrin, Midol, Nuprin, or ibuprofen. Also, do not take any of these prescription medications after transplant: Indocin, Celebrex, Toradol, and Naproxen. Additional resources and information for transplant patients can be found on the websites below: United Network for Organ Sharing /OPTN, Texas Kidney Health, and then transplant support groups are available through transplantliving.org and the Renal Support Network, or rsnhope.org. Additionally, you can go to these websites: Centers for Medicare and Medicaid Patients, the National Kidney Foundation, International Transplant Nursing Society, and the Scientific Registry of Transplant Recipients. Thank you for your time today. A transplant team member will be available